The Benton County Environmental Health Department is teaming up with OSU to put an end to the norovirus outbreak on campus.
Norovirus is a type of illness that's easily transmitted from person-to-person contact, or it can be transmitted through food. The first cases started to report just a day or two after OSU started up their term. So since the outbreak began, we're somewhere up at around 90 to 100 cases. But I think it's important to also point out that the number of cases does seem to be declining.
Even though the number of cases has declined, it's still imperative to frequently wash your hands.
Well, what we mean by effective hand washing is a good, thorough physical scrubbing with plenty of soap and water for at least 20 seconds.
There are many ways that you can contract this virus.
Well, bathroom surfaces, of course, are very risky. And then anytime people contaminate their hands with the virus, if they touch doorknobs or cabinet knobs or those type of things, desks, countertops, then other people can come by and touch those areas and then, pick up the virus.
There are ways to ease the symptoms of the norovirus if you have already contracted it. But remember to remain in isolation for up to 72 hours after your symptoms have stopped.
The most important thing if you do get the illness is to keep up on fluids, and so sipping little bits at a time is what we tell people when they're vomiting, so they'll retain fluid. And the biggest risk are people living in residence halls because they share bathrooms, or other living areas like Greek houses. It is important people know that the alcohol-based hand cleaners do not work against norovirus.
University Housing and Dining Services is taking extra precautions to prevent further spread of the virus.
Well, we're doing a couple of things. We immediately notified our custodial team to increase their frequency of touch point cleaning, so door handles, elevator buttons, door jambs, the kinds of things that everybody touches on a day-to-day basis to prevent the spread.